I'm Daniel Marin. Welcome to 9 on 9, our weekly interview show. We take you in depth on a topic. Tonight, it's a checkup on El Paso's medical school. The Paul L. Foster School of Medicine, part of Texas Tech University Health Sciences Center El Paso, is the first and only four-year medical school in our area. The first class was seated in July of 2009, and just like us, the school has been navigating the pandemic while trying to reach the goal of growing local doctors to serve our local medically underserved community. I recently spoke with an administrator and a student. 9 on 9 starts right now. All right, well, joining us now is Cynthia Perry, the Assistant Academic Dean for Admissions at the Foster School of Medicine, and Valeria Varela, a third-year medical student. Thank you so much for joining us. Cynthia, I want to start with you. This last year has shown us that we need medical professionals more than ever. The pandemic, it got to a point where we had to bring in, like other communities, we had to bring in outside doctors, outside medical help. We really need doctors here along the border. My question to you is, did the pandemic hurt medical school recruitment at all?
So we went into this admission season actually worried that we were going to see a drop in medical school admissions. A lot of students, a lot of medical school applicants were hesitant and concerned going into this past cycle. They weren't sure about the type of opportunities that they were going to have to prepare themselves with the restrictions that they faced during the pandemic. But actually, now that we're on the other side of this admission season and we're getting ready to matriculate the class of 2021, we were actually pleasantly surprised. Students and applicants really turned out in record numbers to apply for medical schools really all across the state of Texas and across the nation. We think that there was a number of different reasons that happened. Students who may have been hesitant about applying, I think, had a change of heart and were inspired to pursue the career and really want to make a change in their community. And certainly applying to medical school and making that career decision, it's a long-term investment. So this isn't a decision that students made overnight, but I think that any of those that were hesitant or unsure of what career they wanted to pursue were really kind of pushed towards the direction of a medical profession.
Valeria, what were your classes like over the last year? How did they change?
So I'm a third-year medical student, which means that most of my day is spent at the hospital and at the clinic serving patients. So the beginning of the year was definitely a difficult time. We started virtually, so we did a lot of virtual encounters, virtual patient encounters, speaking to them over FaceTime, over different platforms to be able to see what they were going into clinic for. But then we were able to, due to the vaccines and due to the different precautions that our school took, we were able to go to the hospitals and the clinics. So since around August, I've been able to be in the hospital and the clinic and serving patients and seeing firsthand what physicians do, helping with them, helping them with histories as far as treatment plans. So the beginning of the year was definitely different than most students that are third years, but the end, it's definitely been how it's traditionally supposed to be, obviously taking the different precautions for COVID.
And early on in the year, Valeria, did you find yourself doing things that you didn't think you were going to be doing at this point?
I definitely did stuff that I didn't think I would be doing. I was seeing patients from home, so that was definitely an experience that was very unique and very different than what most people experience during medical school. But I also learned a lot, and I realized that now if I ever have to do virtual encounters, I'm prepared for them. My school really prepared as well to be doing these virtual encounters with other patients. So I'm grateful for the opportunity as well.
Cynthia, how do you recruit local talent? How do you get local students from here in El Paso into our local medical school?
I think one of the biggest things is that students have an innate desire to give back to their community. I think our region gives our students so much. It's so family oriented that a lot of our students really do have the desire to want to stay here and study here. We've been really lucky with recruiting local talent and having medical students that are from the region or from other border counties as well that want to come and train here for their future practice. I think one of the things that's attractive to students is getting to train in a community that's similar to where they want to practice. And so I think that that's definitely something that stands out to applicants. We also have Spanish as actual requirement for our medical students. And that's a unique opportunity, unlike most medical schools across the nation. So there's several things, I think, about the Foster School of Medicine that really helps us to recruit local talent.
And Valeria, what attracted you to the Foster School of Medicine? Why stay in El Paso?
I was actually born and raised here in El Paso, so I attended Burgess and then went on to UTEP for my undergraduate career. And I was really excited about a medical school being here. I was born and raised, like I mentioned, so being able to see firsthand the type of patients that I'll be serving, hopefully in the future and once I have my own practice, it's really rewarding, really exciting.
Well, we're just getting started here on 9 on 9. We're going to take a quick break. When we come back, we're going to talk about keeping local talent here in El Paso once they graduate. This is 9 on 9 on KTSM 9 News. Thanks for being with us. Welcome back to 9 on 9. We are talking with El Paso's Texas Tech University Health Sciences Center El Paso and the Foster School of Medicine about our local medical school here in El Paso. Cynthia, lots of times we educate these students. A lot of times they'll come in from other places. They attend the Foster School of Medicine. They actually turn out to fall in love with El Paso, but then they might leave for residency and then we never see them again. So how do we keep them here in El Paso or get them to come back?
Absolutely. I think that there's a couple of things that we're trying to do strategically to retain our talent that we're training. One of the things is creating new residency programs. And we've been really successful at doing that, expanding our current residency programs and creating new programs. One of the ways that we've done that is through our unique partnership with Trans Mountain Hospital and Hospitals of Providence. That has enabled us to open a number of new residency programs and just expand the opportunities that students have to train here and fill those residency slots here. We've also really been looking at, I think, increasing our recruiting of the local talent because the local talent are more likely to want to stay here and practice here. And one of the ways that we're doing that strategically is through increasing financial incentives for our medical students. Providing scholarships for our regional students is really important, and we've been really fortunate to have some fantastic local donors and sponsors that have really stepped up, helped to provide student scholarships so that students understand that they're valued and that our community values them. And when they have that sort of investment in their education, students are more willing and wanting to give back to the community and stay here and practice.
How do you go about kind of, I guess, upping the donations, and how do you try to reach out to those donors and get more donors so there's more money to keep the talent here? Yeah,
absolutely. One of the ways that we're doing that is by opportunities like this. You know, we've been in the community for decades. The Foster School of Medicine just recently celebrated its 10th anniversary as a four-year medical school, but we've actually been here for 40 years prior to that, training medical students in their third and fourth years. And even so, we're still making a name for ourselves in the region and across the state and nationally. And so I think just continuing to get the word out there about the impact that our graduates are making, the impact that our institution is making is important, and it's helping potential donors to see that their investment really is going back to the community.
And do you find that's beginning to settle in a little bit, maybe on the recruitment end when it comes to students? Are people becoming more aware of the Foster School of Medicine? It's becoming a name out there?
It is, yes. It used to be we would go out on the recruiting trail all across the state of Texas, and we were kind of the new kid on the block. We're not the newest medical school in the state of Texas anymore. We've definitely made a reputation for ourselves, and it's really exciting to see the word getting out about the fantastic and unique education that students can receive here in El Paso, and the reputation that our program has for the quality of training and preparation that our students receive to go out into their practice.
Valeria, what do your classmates say about El Paso? What do they say about what it's like being here in the city, maybe sticking around and serving an underserved community like ours?
They definitely say a lot of good things about El Paso. They definitely say how welcoming our patients are, as well as our community. And I see a lot of them through our education, now that we're third-year medical students, a lot of them express their desire and staying here for residency. And I hopefully, like Dr. Perry mentioned, these scholarships and different things really help medical students and are huge incentives to be able to stay here.
All right, we still have much more to cover here on 9 on 9. We're talking about El Paso's medical school. Welcome back to 9 on 9. We are talking about El Paso's medical school and keeping local medical talent here in El Paso this evening. Dr. Perry, you were telling me that you have some pipeline programs here in El Paso specifically to recruit El Paso students, get them here, educate them here, keep them here. Talk about those.
Absolutely. So the Office of Admissions for the Foster School of Medicine actually is really interested in working with students, not necessarily just to go into medicine, but go into any healthcare profession. So we do work a lot with the community. We have a number of different outreach programs that we work with. Those include MedVenture. MedVenture is a program that's held late January, and that actually targets middle school students and their teachers, and parents are invited as well to attend. That program really helps to expose students in that age range to a wide variety of different health career professions. So we expose them to dental professions, medical, nursing, physical therapy, pharmacy. They get a really wide range of exposures just to help start and spark that interest in them. We also hold a high school summer camp. We're actually accepting applications for our high school summer camp right now. We're really excited because this summer we're actually going to be able to hold it in person. We have a large, beautiful, brand new auditorium that we're going to actually be able to bring students onto campus, safely socially distance, and be able to do a lot of really fun hands-on activities for high school students. And so I would definitely encourage parents and students to look for that application. We also work with some statewide programs as well. One of those programs is JAMP, that's the Joint Admissions Medical Program. And that's a program that's actually funded by the state legislature, and it's designed to recruit students who otherwise may not have the opportunity to go to medical school. They come from lower socioeconomic backgrounds, and maybe they don't traditionally see themselves as having the opportunity to go into a career in medicine. Those students are actually identified early in their college careers, and they apply to this pipeline program, and they're prepared and groomed and supported financially and with study skills to actually go into medical school. And those students are actually guaranteed a seat in one of the medical schools across the state, and so we're really excited to be participating in the JAMP program as well.
And Valeria, I understand that you are a product of one of these pipeline programs.
Yes, so I was actually a product of the JAMP program, and I'm super grateful for that because otherwise I wouldn't have had a lot of the opportunities in my undergraduate career. So the way the program works is you apply after your first year of college, and then usually you do some interviews, and after that, if you're selected, you're able to do 2 summer programs at different medical schools in Texas. So I was fortunate enough to be able to go to Lubbock, and then I was able to go to Galveston. And due to these programs, I was able to see cadavers as an undergrad student, work with anatomy, work with the different professors, and see the way the medical schools run in the different locations throughout Texas. I'm very grateful for the opportunity to have been in the JAMP program because through them, I was able to get certain study skills, certain opportunities that otherwise would not have been available to me otherwise.
All right, we are going to come back after this break with some closing thoughts. You're watching 9 on 9 here on KTSM 9 News. We're talking about El Paso's medical school here on 9 on 9 this week. And before we wrap things up, Dr. Perry, give me the short sell that you give to students, potential recruits, when you're trying to get them to come to El Paso, come to the Foster School of Medicine.
Absolutely. The Foster School of Medicine at El Paso is a fantastic place for students to study. It's a fantastic place for students to come and prepare themselves for their future career in medicine. We pride ourselves on being an innovative program. We were founded on the concept of innovation and being a learning community that provides a lot of support for our students. We're very student-centric, and we have developed our curriculum so that our students not only get the important fundamental foundation of biomedical science concepts, but clinical science is integrated from the very, very beginning. And that's unique in medical school curriculum, and we're very proud that we were one of the founders in the U.S. to bring that type of curriculum to the States. A lot of medical schools are actually modeling their curriculum after what we've developed here. And that's certainly something that we're very proud of. And we're also really proud to be located here in El Paso. I always tell potential candidates that they're going to come here and they're going to be part of a family, part of a community. They're going to be welcomed with open arms, and they're going to get exposed to patients that are going to be really appreciative and really open to helping further their career and their training, and also welcome them as newcomers to the region.
Valeria, what would you say to potential students out there who might be watching this or thinking about a career in medicine? Why choose El Paso? Why choose Foster School of Medicine?
There's definitely different programs, like Dr. Perry mentioned, that were super beneficial to prepare you for medical school. And as far as choosing Paul Foster, we definitely get a curriculum where we see patients from our first week of medical school. We start with standardized patients. And now that I'm in my third year, due to those encounters, I feel super comfortable seeing a patient, diagnosing a patient, and coming up with a treatment plan. I definitely feel like my education has been phenomenal from the beginning, and I'm very excited to graduate hopefully next year.
Dr. Cynthia Perry, the Assistant Academic Dean for Admissions at the Foster School of Medicine, and Valeria Varela, a third-year student there. Thank you so much for being with us. And thank you for joining us. Don't forget, if there is a topic you would like to see us talk about, just reach out to me on social media. I'm at KTSM Daniel Marin. Have a great night.